Right, okay, so we're going to do a movement that is going to work on pronation and supination of the feet. So some people, after having kind of an ankle sprain, can struggle to find one position or the other. One of the reasons that they can have an ankle sprain is because they can't necessarily find one position or aren't very good in one of those positions or the other. So we're going to do an exercise now to work on both of those. And what you're going to find is that foot positioning can also dictate hip positioning as well, which is why sometimes if prescription of glute activation exercises don't necessarily work sometimes, is because people aren't looking at the feet and aren't looking at their effect on the gluteal and hip musculature. So what we're going to do, you're going to take your shoes off, you're going to get your feet about hip width apart, and then what we want to do is we want to imagine our feet are on paper plates. So those kind of party plates that you get, that you have kind of, all the party food and all that sort of stuff. So you want to imagine your feet are on these plates, and then what you're going to do is keeping your feet perfectly straight, so facing straight forwards, we're going to try and turn our feet or screw our feet into the ground. So we're going to try and turn those plates outwards, or anti-clockwise and clockwise, okay? And that's going to create a nice little arch in the middle of the foot, okay? So the medial arch of the foot, so that's going to create that. So what you can do is you can either hold that for time, so 5 or 10 seconds, and then release. But what you'll notice is if you look at my kind of, trousers aren't quite tight enough, but if you look at my knees, when I turn my feet out, my knees tend to change position. Now that's a slight optical illusion because the movement is actually coming from my hips. So when I try and twist those feet out, and I try and screw my feet into the floor, it's actually my hips turning outwards and turning into what we call external rotation. Okay? And then of course, so that's supination of the foot, okay, creating that nice arch, that nice stable platform. Often weightlifters will use this to help strengthen their squat or to give them a better base to squat from. So then we've got to go the other way, so you want to do pronation. So you want to imagine you're twisting your feet inwards, so clockwise and anti-clockwise this time for opposite foot. And again, you're just going to hold that one for a few seconds. And again, if you look at my knees, you can see when I collapse the foot in, my knees come in at the same time. And that puts my hips into internal rotation. Okay? And that's what stretches the back side. And that's what oftentimes in gluteal activation exercises gets missed out, is that it's the foot you need to concentrate on, not the back side, because if we get a good stable position, that activates those glute muscles. Okay? So give that one a try and let us know how you get on. Bye bye.